called to a residence for an unconscious subject. Upon arrival at a 5-story apartment building, you notice it is dark from the outside. Law enforcement is on scene and has declared the scene safe. The young woman is frantically waving you over. As you walk in, you see a younger man lying supine on the steps. He is pale, sweaty, and appears unresponsive.
Alright, well I got my proper PPE. Is my scene safe?
Yes.
Nature of illness or mechanism of injury is unknown at this time. I see one patient. Do I have any more?
Nope.
Alright, I'm going to go ahead and call ALS. And C-spine, I am going to consider C-spine at this point. General impression, I have a young man laying down supine, unconscious. AVPU, so he would be unconscious. I'm going to check for painful stimuli. Is he responding?
Responsive to painful stimuli.
Okay.
Only.
I would ask the chief complainant, but since he's unresponsive, what is the chief complaint?
Unknown.
Unknown at this time. Okay, well I'm going to go into my ABCs. For this patient I'm going to do a jaw thrust just because I don't know if the spine is injured or not. So I would open the airway. Is the airway patent?
Yes.
Okay, and I'm also noting any, for his breathing, I'm going to listen to the lung sounds. Is there movement throughout the lungs?
They're clear and equal bilaterally.
Okay, I'm also looking and listening. I'm looking at the rise and fall of the chest. How is that?
Symmetrical rise and fall chest.
Okay. And then is there adequate ventilation?
Normal rate.
Okay. And then what is his SpO2 at this time?
97.
97, okay. Alright, I'm going to check his circulation. I'm going to check for radial pulse first.
Strong and equal.
Strong and equal. I'm also checking the color, condition, and temperature of the skin. How are those?
Cool, pale, and clammy.
And I'm also checking for any major bleeding or life threats. Are there any apparent at this point?
None.
Okay, at this point I am going to administer a nasal cannula at 2 liters per minute just because the skin is cool, pale, and clammy. And I'm also going to check the blood glucose level at this time. Does that go on?
That is 25.
Okay. And this patient is an immediate transport. So now I'm going to go into history taking. Is there any witnesses around that can give these?
Yes, as a friend.
Alright, so signs and symptoms.
Equal respirations, skin is pale and cool, lungs are clear and equal, and no evidence of trauma.
And is the patient allergic to anything?
Unknown.
Is it known if the patient is taking any medications?
The friend states that he takes insulin.
And past medical history?
A friend states that he has diabetes.
Does the friend know his last oral intake?
They had dinner 7 hours ago, then drinking most of the evening.
Does it say about how many drinks they've had?
No.
No, okay. And then events leading up to this.
The friend states that they had been out to dinner and then went clubbing. She states that the patient has been drinking heavily, and she thinks that he took his insulin before they went out. He appeared to be acting drunk all night and passed out as she tried to help him upstairs.
Okay. And has the patient passed out suddenly or?
Approximately 7 minutes prior to arrival.
Alright. Since the patient is passed out, there would be no pain noted, but I'm still going to ask, does anything make the pain better or worse?
Not applicable.
And can you describe this pain to me?
Not applicable.
Does the pain radiate anywhere?
Not applicable.
severity on a scale of 1 to 10. How bad is it thinkable? And then time, you said 7 minutes prior.
It says unknown.
Unknown. Okay. All right. For my secondary assessment, I'm going to focus on neurological. I would also check the pupils at this time. Does it say if they're? Okay. Okay, now I'm going to be getting my vitals. Alright, patient's vitals were 98 over 62.
118 over 70.
Alright, I'm going to be checking the pulse and respirations at this time.
I'll start the time.
Alright, 30 seconds. 62.
Seconds.
14 breaths.
Alright, so then pulse is 108, and then respirations is 12.
Right, and SpO2 you said was 97.
Yep.
Alright, and does it say anything about the pupils?
Nope.
No. Okay. At this time, I would probably do a head-to-toe assessment just because the patient is passed out to check for any secondary injuries. Were there any noted? Okay. My state my field impression. I believe the patient is suffering from hypoglycemia, also intoxication. My interventions and treatments, I do have the patient on a nasal cannula at 2 liters per minute, and I would not be able to give oral glucose because the patient is passed out, and I will reassess the vitals every 5 minutes, and I will check my repeat vitals just with the O2. Haven't they changed at all?
Yes. So blood pressure 120 over 72. Pulse is 110. Respirations is still 12. And then the SpO2 is at 99 on oxygen.
Okay. Alright, now I'll give my report. This is Medic 1. I have a young male who is unconscious. He is cool, pale, and clammy, suffering from possible hypoglycemia. His blood glucose level is 25 at this time. Patient has clear lung sounds, normal respirations. Unknown allergies, medications. A friend states that he does take insulin and has a pertinent past history of diabetes. Witness states that patient has eaten 7 hours ago and has been heavily drinking since. Passed out about 7 minutes prior to our arrival. Repeat blood pressure is 120/72, pulse 110, respirations are 12, SpO2 is at 99, and nothing stated about pupils. I did give a nasal cannula at 2 liters per minute. I did not administer any oral glucose. We were about 5 minutes out.